my name is Elizabeth.
Hi.
I'm a student nurse practitioner, and I'll be teaching you about your self-breast exam today. First off, we're going to assess your risk of breast cancer.
Okay.
I'm going to ask you some questions, and then it'll come up with a percentage. And this is called the NSAB risk model. And I'm using this model rather than the Gale model because the Gale model assists breast cancer for women or men over the age of 35. Right? Do any of your siblings have breast cancer or had breast cancer?
No.
Okay. Have you ever had a benign breast biopsy?
No.
What age did you start your menstrual cycle?
12.
12? Okay. At what age did you, or have you had any kids?
No.
What is your age?
29.
29. And then what is your race?
Caucasian.
So all those questions having to do with your history of breast cancer, if you've had a biopsy, if you've ever given birth, increases the risk of breast cancer. So I'm going to calculate this, and you have an estimated 11.9 within your lifetime to the age of 90, which is a very low number. Okay. Do you do your own breast exams at home?
Sometimes.
How often are you doing them?
When I remember.
So, you want to do your self-breast exams every month, 5 to 7 days after your period. And we want you doing them at home because you are most likely to find any breast abnormalities compared to coming in every year and seeing a physician. Okay. So what you want to do is look at yourself in the mirror. I'm going to have you do this along with me.
Okay.
So what you want to do is raise your hands up. So as I'm going to also observe, but you want to look for symmetry. You want to look for any abnormal discoloration in your nipples and the skin on your breasts. You want to look for swelling. Also, you're going to look for discharge at your nipples. And also, we want you to put your hands at your hips. I'm going to do this shrugging motion. And at the same time, you're also looking for swelling, symmetry, and other discolorations that you're able to notice.
Okay.
And next, I'm going to have you lie back.
Okay.
So when you're lying down, we want you to have, we're going to start with your right breast. So put one hand on top of your head or over your head. You want to start with your lymph nodes, so I'm going to start at your collarbone, and you're going to use the pads of your fingers using a circular motion. What you're looking for is any hard, fixed, unmovable nodules. Everything seems good. And then so you want to start at the edge of your armpit right here, doing the circular motion, going inside to the center, to the inside, outside to the inside, all the way to your nipple. And if you feel any pain at all, you also want to look on the other side to see if it's symmetrical for pain and our lungs.
Okay.
Right? And also with your nipples, when you get to the center, you want to kind of squeeze it and express it, looking for any drainage, tenderness, or any skin abnormalities.
Okay.
All right. And you want to do that with the same, your other side.
Okay.
Okay. Do you have any questions?
No, thank you.
No? Thank you.